We're going to talk about a way of understanding trauma and one that may be surprising to you. Based on this way of seeing things is based on the work of Bessel van der Kolk, Judith Herman, and a number of other people that we're going to be talking about in the semester. The video that I have, video link that's in your with the video and in the folder on D2L really is a useful one and a good complement to some of the ideas that we're talking about here. We're going to start by looking at something that Kizzy Lehman talked about in terms of his history with his mother. So he said, I cared about the way you'd grit your teeth when you beat me for not being perfect. I cared about girls at school seeing my welts. I cared about you. Days and often hours before you beat me, you touched me so gently. You told me you loved me. You called me your best friend. You forgave me for losing the key to the house. You coated the ashy cracks in my face with Vaseline slick palms. You used your nubby thumbs, wet with saliva, to clean the sleep out of my eyes. You made me feel like the most beautiful Black boy in the history of Mississippi, until you didn't. I didn't try to hurt you, you told me the last time we spoke. I don't remember hurting you as much as you remember being hurt, Key. I'm not saying it didn't happen. I'm just saying I don't remember everything the way you do. I still believe you. So, a couple things to pay attention to. One is that Kizzy and his mom perceive things differently. And that perception is then going to influence how Kizzy behaves. Now, this difference may be due to a number of different things. It may be related to Kizzy thinking, or Kizzy thinking that her behavior is very different than what anybody else's mom does. It may be that Kizzy's mom recognizes that what she's doing is wrong, but she doesn't want to admit it. It may be that it's normal given her own history of abuse. So a number of different things to think about here. As we're talking, you might ask, does abuse impact physical and mental health? And the answer is very clearly yes. We're going to be talking about this, here and elsewhere this semester in terms of odds ratios. So we're looking at relative to people without abuse. How often does this happen? So physical health problems are about twice as common. Anxiety, more than twice as common for people with pure abuse only. When we're looking at other abuse only, neglect, emotional abuse, physical abuse, sexual abuse, 2 to 3.5 times as likely. And when we're talking about both bullying and other kinds of abuse, we're talking about a lot of problems in physical health, mental health, anxiety, and depression, between 2.5 and 5.5 times as frequent. You're going to want to be paying attention to these asterisks because the asterisks mean how unusual is this? So when these two asterisks, we're saying less than 1 in 1,000 times would we expect to see this by chance. It's easy when we're seeing someone like Kizzy Lehman or his mother to ask the question, what's wrong with you? And what I want you to be asking instead is, what happened to you? So what is it that caused you to behave in this particular way? So rather than only focus on the symptoms, think about the root causes. in this case, trauma, that may put someone at risk. When we know that, we're more likely to choose to use trauma-informed care. That trauma-informed care can help make behavior and symptoms more understandable. So Kesey may look at himself and say, this is why I behave the way I do. It may increase his empathy for his mother. So he may stop and say, I understand why you behave the way you do. And it directs treatment and goals in helpful ways. So what we're thinking about here is that with trauma-informed care, we're going to behave with greater compassion. So kindness, gentleness, understanding, and also self-compassion. So mindfulness, awareness of what's going on when we're stressed or angry, behaving with gentleness, kindness, the way that we might to a best friend. And to recognize that we're not the only person who behaves in this way. Now, in the therapy room, or when we're working with people who are survivors, we're going to be working collaboratively and respectfully. So our question is, what happened to you rather than what's wrong with you? Creating a sense of safety and trust, so it's easier for someone to be willing to work with them. For people who haven't always felt like they've had a sense of control, to give them some choice. Do you want to talk about this today? Where do you want to start? Do you want to do this first or later? And behave in an empowering way. And that empowering way makes it possible to take some of the risks and keep those risks, keep that way of approaching things going across time. I'm going to stop here and I'll see you in the next video. Take care.